everyone. It's Emily here today. I have a very special guest here, Juliet Keeler-Labine. Juliet is, I came to know Juliet unintentionally many years ago because a friend had worked with you and she had a great experience. And she told me about you. And you worked with her regarding loss. So then when I had another friend who experienced loss, your name was in my brain. And I thought, I remember this woman who helped my friend. And so I just sort of had your name in my brain and I just started referring people to you, and people that I knew who worked with you loved you and adored you and found you to be very helpful. And we at NAPS are very fortunate that a lot of what we do is very happy and we take care of many families, but we are sometimes faced with tragedies, right? That's how it was as a labor and delivery nurse for me, with loss, whether it be miscarriage up to infant loss. And whether you wanted it to be your niche or not, you were really good with these moms who had experienced loss. And I sort of just started sending them your way. And then recently we connected and you were like, who are you and why do you keep sending me people? So let me properly let you all meet Juliet. Juliet is an independent clinical social worker. You have a private practice. You're a clinician with over 10 years of experience. I know you do other things outside of trauma and loss, like you treat anxiety and depression, relationship issues, helping people with mood disorders and work-life balance. But what's super cool is you have experience with CBT, mindfulness, psychodynamic psychotherapy, trauma-informed psychotherapy. You're basically a badass and you're a mom. So I'll let you say hi now because I just think you're awesome. So welcome. Thank you for coming.
Thank you so much for having me. I have never had an introduction like that. So thank you so much. And your very kind words. I love what I do. I'm passionate about what I do, and loss is my specialty. People are often very surprised by that because it is such a difficult topic. And I really became very interested in grief when I started my practice almost 20 years ago now. So yes, it is over 10 years of experience, but over 20 years ago.
Now we need to say over 20 years of experience.
No, yeah, no. Oh, no, not quite.
Yeah, almost.
early 20s. Yeah, so almost. But it started when I was an intern. Okay. And I worked with in a foster care agency, as many of us do. And I worked with moms who had their children, their babies, newborn babies, for whatever reason, were moved from them. And I worked with a program that helped the moms to reconnect with their babies and to help the moms kind of learn how to parent, learn how to play with their babies, learn how to be with their babies. It was a wonderful program. And I'm so lucky I got to be an intern there. And I got to see the mom's grief over what had happened. And so I became interested in the moms and their loss. Even though this was a play group for bonding babies, I got really interested in the moms and their loss. Mm-hmm. From there, I got to work in HIV medicine. And it was just such a wonderful experience. I worked there for years. And again, I worked with largely men who identified as gay, and worked with them. And a conversation that kept coming up, even though we were talking about a lot of things and medical management and outpatient care, what kept coming up was the grief over having lost so many friends, partners. And even though these events had happened 10 years prior, 15 years prior, the grief would come back fresh if they would get a credit card statement in the mail that had their partner's name on it. So I became really interested in grief. From there, I worked in, I took a little time off to have kids. So I have 2 boys, they're now teenagers. And then I worked in neurology, neurosurgery, inpatient unit on the floor. And that's where I worked, as the things happened. And I really helped people with cancer diagnoses. I really helped people with motorcycle accidents, basically major accidents that could affect the brain and spine. I was right there. And it really did introduce me to the immediateness of grief. So I really became invested and involved. So, and then of course I did all sorts of classes and learning and EMDR training around this.
Right.
But I was very much an expert on grief, right?
And trauma.
And trauma.
It's very traumatic.
Yes. It wasn't until I myself went through trauma. And in the span of 9 months, I lost a very good friend of mine to an accident. She was only 30 years old, and I lost a very good friend to an accident. I was looking forward to having lunch with her because I wanted to tell her I was pregnant and that I was expecting my third child. For a host of reasons, that pregnancy did not happen, and I lost the pregnancy. It was a awful collision of my own health and the health of the pregnancy, and it was incredibly traumatic to lose that pregnancy and also lose any future fertility. And as a woman who had been through infertility, I know just how magical fertility is. So, having had fertility treatments work for 2 incredibly healthy, easy pregnancies. Here and there, some issues, but I mean, I was super lucky. One of those women who basically had a baby, lost all the weight, and 3 weeks later, and I was in my jeans.
What the heck?
I know, right?
Unicorn.
And I'll also tell you, my first son slept through the night at 5 weeks. Don't worry, my second son let me know how tough it could get. But
Juliet, we want people to listen to the podcast today.
I know, right?
I'm just teasing you.
I know. And losing that pregnancy and losing future fertility was devastating. I didn't know how devastating it was because I so dissociated and repressed the horror and grief of that, because that was how traumatic it was. And I really got to know exactly what that was. 9 months later, my beloved dog died. And anyone who knows me knows that I always have a yellow lab. Yeah, I have 2 yellow labs right now.
And we have a yellow lab too.
Oh my
She's the original baby. Yes.
Yeah, and they really are. And it was when my dog died that all of a sudden, all of the grief came in that I had been academically really kind of suppressing.
Right.
And I went on the wild ride that is grief. And it really taught me personally the grief journey that is, and also how we can live with grief and also live with joy at the same time. But grief is part of life.
Mm-hmm.
And as a clinician and academic before, I had always looked at grief as, oh, okay, this is something that we move through, get over, and I'm going to provide these treatments and tools and tips and all of these things.
Right.
And then when I went through it myself, I was, as someone who lost a good friend to a tragic accident terribly early, as someone who lost a baby, as someone who lost a beloved dog to a horrible cancer diagnosis, I was able to really step in and say, now I live with it and I understand what that is, and I am much better to help people.
Right.
Having lost my pregnancy, one of the things that shocked me was there were no resources. I know everybody. I know a lot of people. I've been doing this a long time. There were no resources for baby loss. And so as I moved through my grief journey, I realized I'm going to be a resource.
It's a bit wild to hear that too, because you think about the space that you were working in and all of that experience that you just listed that you have. So imagine the context that you have as well, just so well versed in that space. And then to have you say, when you needed resources, there weren't any. And look where you came from, right? So imagine everyone else who doesn't even have that context or that experience. It's mind-blowing.
Yeah.
That is like a really big reason why I felt like it was important to have you on today. First of all, it's October, as people are listening to this, and October is Pregnancy and Infant Loss Awareness Month. I do feel like we don't acknowledge this enough in general, but so I appreciate that there is at least a time where we can like call it to attention. But in light of doing that, even when I thought about this month and what we might want to talk about or consider or content that we put out there, again, like I'm in a medical profession and pretty well connected here at NAPS, and I still was struggling to find the best resources to give to people this month and in general, right? Like and so I don't know, you might not have an answer to this, but why the lack of resource? Are people, are we lacking because it's a uncomfortable topic and space for people to be in, so maybe people avoid it? Or there's like a shortage of people that are in this profession? Like, what's happening?
Yeah, I think it's a really good question. First, I think that it is an incredibly uncomfortable topic, and the death of an infant, the loss of a pregnancy, is something that people really want to never speak of again. It is so awful, so shocking. Cassie Underwood is a writer, and she's got a great line. She actually was writing about her pregnancy loss through abortion. And she said, my community was everywhere and nowhere, because she heard these statistics, 1 in 4. And she was like, my community is everywhere and nowhere. So number one, people really have a hard time talking about it. People have a hard time conceptualizing it. And number two, you're right. It is very uncomfortable for clinicians to move into this space. And to that, I say to my colleagues and peers in medicine, we can do better. We can do better with this. We can accept that there is a hospice palliative care purview that we can bring into this wing of medicine. Yeah. And we don't have to just offer sympathy, but we can offer space to people who are bereaved in this space, rather than say, well, at least it was early. Like, what? We've got, here's a pamphlet.
Shall we do the thing on the podcast right now, which is like the shit that you shouldn't say to somebody who's experienced loss?
Yeah, I know. Tell me about it. I know.
So I think it's no surprise to people listening who know me at this point know that I did lose my sister as a baby to SIDS. I'm the oldest, and I was in 3rd grade. I remember a lot, like if not almost everything. Shockingly, I was older, but in this context, I remember being a child and having people say to me, and even growing up through my life, that I was lucky that it happened to her at such a young age. Yeah, no, people said that to me. And so I think people listening know that like people can relate to just the dumb shit that people say, like even a miscarriage, like, well, you were lucky that it happened so early. A medical termination, well, you were lucky that you could handle that at that time. Or a loss of a child, like, oh, it was good that they were so young. Like people actually say this stuff to you. And that's incredible. So I think like, one, I'd love to call out the things that please just don't say it. And 2, like, how do you respond? What do you tell your moms when you work with them, when somebody says something like that to them? It really fucking hurts.
It really fucking hurts. And one thing that I always say to people is, I always open with this. When someone confides in you their infant loss, their pregnancy loss, you might say the wrong thing. You might say the wrong thing. I work with people day in, day out, and I often say the wrong thing. But here's the thing. Have awareness to say the most important words in the human language, which are, I'm sorry, let me try again. And so I open with that. Don't forget the words, I'm sorry. I open with this. Look, when someone confides to you their pregnancy or infant loss story, and it is incredibly painful and personal, because one thing about pregnancy and infant loss is that it's full of shame, because there is a component in every parent, moms and dads, and I do work a lot with moms, but I do work with dads too, and I work with couples and families. And one thing is it was my job to protect them. And that shame of the not protecting, even though it's not true, it feels so real. So when somebody says something stupid, they're reinforcing that shame. And I'll give Brene Brown the credit here because she's done the extensive work on shame. What shame says to us is, I am a bad person. And there's nothing worse than not being able to protect the most precious thing to you, your little cub. That's our main job as a human species. So, okay. So, one thing that I always say to people when they're like, oh, somebody told me about their pregnancy and infant loss or infant loss, one thing that I say is, number one, this is not your story. Your beliefs actually don't matter here. Your place is to listen. Your place is to say, I'm sorry. That's what you need to express.
Yeah.
That is it. One thing that we do as human beings is we want things to be okay. I will never, ever, ever, A, because I've gone through it, and B, I will never tell a pregnancy and infant loss family, and things are still going to be okay. Things will never return to equilibrium. Your life is forever altered and changed. And so I tell people, what is it that I say to people who experience loss? And I'm like, keep your beliefs out of it. Keep your opinions out of it. Keep your experiences out of it, because this is not about you, even though you want to insert yourself in there to make it all better. At least it was early. At least she was only 28 days old. At least, all of these things, because never, ever, ever does a helpful statement ever start with at least. So,
Nope.
right. And also, your spiritual beliefs may be really helpful to you, and that's a wonderful thing. It's an important dimension of life. Keep your spiritual beliefs out of someone else's story. You don't need to insert heaven has another angel. You don't need to insert any of that. That can be offensive to people because it may not be their belief system. I wasn't raised Christian. It's not my belief system. So all of a sudden, the story has now become about you. And one thing that does is it makes the bereaved have to rush in and say, oh, but it's okay. It's okay. You're so right. So it can be really difficult, but just listening. One thing that I always say too is just bring the fucking casserole. Like, don't say, I always tell people that, absolutely, after, just listen, hold space, and express, I'm sorry. Don't sit there and say, let me know what you need. Anything you need, let me,
You know why I think we do that as the human species, as we've talked about, like, you feel uncomfortable. And I learned this as a nurse and like somebody who, I'm a talker. Like, I love talking, and I was raised very social in a way that I always was filling silence with words, essentially. And so in an uncomfortable situation or sitting with a patient or a mom or anybody, sometimes when you feel uncomfortable and it is quiet, that's why people start sometimes saying these things that they don't even mean to say, or they come out. And because it's our human nature to make it better. And then we become uncomfortable because it's quiet and we're like, oh my God, what should I say? I don't know what to say. What if I say the wrong thing? And so sometimes we just start saying things. And for me, like, a huge thing that I still work on, but that I learned through my own experience of grief, of what I would like, is sometimes for people to not say anything at all, but I still want them there. And so I worked on getting really comfortable of my issue, which of feeling uncomfortable, of just being quiet. So when I've sat with women who have experienced loss, I'd say nothing often. I do say, I'm sorry. And I'll acknowledge, like, this is not okay. This is horrible. And then I'm just silent. And we might cry together. I don't say anything. And the longer that I'm quiet, often the more they'll then start talking to me too. But we might sit for 30 minutes in silence before we get to that point.
That's right. That's right. And I think that that silence is so uncomfortable for people. And it's also how you hold space. And trust me, I'm a therapist. I know silences can be really uncomfortable. And as you said, 30 minutes, I'm like, that's a long silence. That's a long
Yeah,
time.
maybe it was 3 minutes and it feels like 30
It
minutes.
feels like 30, right? And it's really important. It's also okay to, as I said, just offer the gesture, bring over the food, send the beautiful flowers, write the condolence card, give the gesture. And also that allows the bereaved to decide how they want to handle it. Do they want to open the letter? Do they want to, where do they want to put the flowers? It gives them a sense of, okay, I've got this, rather than having to be the one to reach out, which honestly, it's very difficult for the bereaved to reach out. It's just not a function of grief.
Yeah, I'd like to talk about that a little bit because I do think in our history here at NAPS and my own personal experience, like truly what happens is when somebody's had a loss, um, lost it could, maybe they lost a baby, like the people in their life become a little bit paralyzed because you don't know what to do. And so the common thing is that, I don't know how to support this person or this family. Um, what should I be doing? So maybe they decide, like, I get it. I don't know what to say. I don't know what to say.
Yeah.
What can I do? What can I do? And then I think people become a little bit numb because they don't know what to do. And is it the right day to go over? Is it the wrong day to go over? Should I ask to bring dinner? Do I just drop dinner off? So you joke about like making the casserole, but we talked earlier about what do you do if somebody says to you, would you like me to bring dinner? So
Yeah.
that's a heavy one for even somebody to answer.
Yeah. I want to get to the kernel of why this is so uncomfortable. And one of the reasons why this is so uncomfortable, and we talked a little bit about this when we were getting to know each other, is that pregnancy and infant loss is outside of the natural order. And this is a death that happens that wasn't supposed to happen. And in my family, we lost a family member at 96 years old. And it was my father-in-law, and we have these wonderful memories of him. 96 years, wonderful man. We have beautiful memories we can talk about. My kids and I can talk about the beautiful memories of granddad. My husband and I can talk about, jokes that he used to say and everything. And we have these wonderful memories to lay back on in our grief as we realize that future conversations can't happen in person anymore. When we lose a pregnancy, when we lose an infant, we do not have that long time of memories. What we have is something that happened outside of the natural order. We're supposed to pass away beautifully at 96. And when we pass away at 96 or 85 or however it is in our elderly years, we have our families that we built, we have the funerals that happen, we have all of the structures in place. But when we lose a pregnancy, very rarely is there a funeral. Very rarely is there anything other than these things happen.
Just say I have moms who lose a pregnancy or deliver a baby, a stillborn, and return to work.
That's right. That's right.
Never happened.
That's right.
It's incredibly sad.
That's right. That's right. That the loss can happen on Saturday and there they are on Monday back at work. You're absolutely right. And it's really tragic, right?
Yeah.
And we have this kind of no structure in place, and funerals may or may not happen, and events, and also we don't have that bevy of memories to really fall back on. What we have is the very painful place of what ifs. And not only what if he had become a lawyer, or what if he had become a doctor, those kind of things of like what would if life had been like. But sometimes we're left with the very searing small traumas that can be even more painful of what would his smile have been like?
Mm.
What would his what would his first day of kindergarten been like? All of these things that never happened, that as we think about it become more and more searing, and there's no place for them to go.
Right.
And so this aberration of nature that happened is very uncomfortable and painful for people to deal with. There's also something else, which is, when our loved ones pass in their older years, we often know why. In preparation to talk to you, one of the things about SIDS is, I was looking up some numbers, and this is from the CDC. In 2020, there were 1,062 deaths of SIDS that were unknown, completely unknown why these young ones passed. So we're also left with, a lot of times we have no idea why this happened. So many miscarriages happen, we have no idea why.
Right.
And so you're not only left in a place of what if, you're not only left in a place of memories that never happened, but you're also left in a place of profound uncertainty and not knowing.
The why too.
The why, yeah.
And it's that I always think of it too as it's sudden. It's this sudden loss, and it's really, you're summing it up in a better way. I always think about loss, like my grandmother who died peacefully in her 90s, and we could acknowledge her memories, versus the loss of my sister, or Jamie and I lost our best friend. Those were sudden, like out of nowhere. But you're describing it better. It's the why and the what ifs. I think of my mom, and she told me at some point that every time we would get seated at a restaurant, the years after we lost my sister, there was always an extra chair at the table. And she always had the what if, or that chair, like just seeing something like that, an empty chair at the table, as me and my mom and my dad and my sister at the time would sit down, that chair was for our sister who wasn't there. Yeah. And so you just think, those what ifs go on forever.
Yeah.
So,
I
is heavy.
It is heavy. It is heavy. And it's one of the reasons why we think it's so tragic when the 58-year-old man dies suddenly of a heart attack, or the 30-year-old dies suddenly in an accident, or, all of those are aberrations of nature. We're supposed to die when we're older and surrounded by family peacefully in their sleep. And a baby loss, pregnancy and infant loss, is the most unsettling, profound example of a death that happens outside of the natural order. So people really have a hard time with this. And at the same time, it's not uncommon. And I say that, I always say to people, what has happened to you is a common occurrence, and your story is unique to you. Everyone has their individual loss story. As I mentioned, I just want to, being a medical social worker, I put together some stats.
I love it.
For SIDS, since we were talking about SIDS, this is from the CDC 2020. On average, 3,400 SIDS cases happened. 1,389 were due to SIDS, which is their own kind of medical designation. That was 41%. As I mentioned, 1,062 were unknown, 32%. And 905 were attributed to some sort of accident that happened in the bed, whether it was a blanket or some sort of accidental strangulation. Stillbirth, which is defined as any pregnancy loss post 20 weeks. And a lot of times we associate it with 37 to 40 weeks, where there is a bit of a spike. There were, in 2020, which is when we have our last data, about 21,000 reported stillbirths. Since the 1940s, there has been a steady decline in stillbirths. But in recent years, we've noticed that decline has completely halted, and it has stayed very stable. That's a lot. Wow. Miscarriage is any loss before 20 weeks. And according to the Mayo Clinic, 10 to 20% of all pregnancies end in miscarriage. And the actual number is probably higher due to reporting, and also some losses may happen just really early.
Exactly.
So that's very high. And then wading into more controversial waters, but I don't want to leave out my grief parents in this area. Termination for medical reasons.
Yes.
And as you can imagine, this is a very controversial topic. We don't have very good data on this. But for a lot of reasons, we don't have very good data on this. But we do know that the Guttmacher Institute, these numbers are from 2017, I think, but they haven't changed that much. Approximately 1 in 4 women will have a termination of pregnancy by the time they are 45. 60% of these women have 1 or more children already at home on average. We don't have that much data. I have seen some data that I can't really verify that 1 in 55 terminations is attributed to a medical reason. And we do have data from the March of Dimes. 1 in 50 pregnancies is ectopic, and that is a pregnancy that cannot continue. So this is there are not many people who this does not affect. You either know someone who has lost a pregnancy or an event, right, or you yourself have.
Absolutely. I would be willing to guess that every single person listening to this podcast has gone through something or knows somebody for sure. Yeah. I think too, I've sat in spaces with women for various reasons. Maybe I'm just sitting here in my workplace. All women work here and we're all moms. It just takes one person to sort of say, this happened to me. And then all of a sudden, another woman in the room, I went through this. And so it does make you wonder, the statistics are great, but even looking at miscarriage, the 1 in 4, the percentages that you gave, it's like, are we really spot on with that too? What about, we're probably missing so many numbers and cases as well. It just
we're pretty sure, and I think that the current political climate is going to make things very interesting. But and again, I stay here in a non-judgmental, compassionate place for anyone who comes to me because they're coming to me in grief and loss. And but we are pretty certain that many people that the number reported is much higher for people who choose termination for medical reasons, whether that's maternal health reasons, which can be thousands of reasons, and also fetal anomaly. And, in terms of stillbirth, a lot of times we think of that as, 37 to 40 weeks, but how many pregnancies are lost earlier at 23, 28 weeks? Right. So, really providing space for that. There's not a whole lot of structure is what, we were talking about before too, for like grief too. Where do you go with it? You were talking about moms going back to work on Monday.
I know. So I'm thinking too, what would be, in my opinion, helpful for people listening is what do we do for people in this space? I want to get back to that a little bit. We've acknowledged that it's uncomfortable and that we can say the wrong things, and it's okay to just say sorry. It's okay to be silent. But knowing that there is such a drastic lack of resources out there, what are the things that we can do as the friends and family of these people?
Yeah. The first thing is I'm actually going to turn it to the bereaved. Okay. And have it be your grief is valid, real, and intense. And that's the first thing that I want to say, because as we were talking about the incredible things that people can say to you, like, oh, she was so young when she died, it's okay. Or at least it was early on in the pregnancy, or you were so lucky to be able to get that treatment. The things that people can say, what they are is well-intentioned, but they're also invalidating. Mm-hmm. Because a pregnancy is real, a baby is real, it is a human being, it is there. So, it can be really invalidating to hear these things. So the first thing I want to say is to the bereaved that your grief is real and that these things did happen. And while it may feel like a lot around you is invalidating the kind of magnitude of what's going on, it's real. And that's okay. Mm-hmm. And if you're having a really hard time, and especially for, all the women particularly who are going through this event, they're also dealing with being postpartum. So special care and attention needs to be given to them as they are going through a physical and psychiatric event. So all of this is valid. So that's the first place that I want to start with, because very often we can feel that, our loss is like, okay, these things happen. I guess I go back to work on Monday, and
Horrifying.
right.
I mean, these women that I take care of that have delivered a baby and you go home without your baby, it's heartbreaking. Your breasts are full of milk and there's no baby to feed, and you're have a incision sometimes in your abdomen, or you're bleeding and you're wearing pads, and you've gone through you've gone through that process of delivery, and you're not bringing your baby home. And to even consider that you would have to function or show up somewhere on a Monday as your body is going through that, it's horrifying. It's more than grief. It's fucking agony.
It's agony. It's agony. And one thing that I feel very strongly, you said resources, is I'm on a mission to help the medical community do a better job. We're uncomfortable. Again, labor and delivery is a really happy place. The babies are born. They're super cute. You get to wrap them up in little blankets. Like, it's such it's a joyous thing. But we can do better with loss too. And it starts with education. It's very hard for, SIDS. There can be so much shame. There can be so much grief. There can be, this event that happened. And then all of a sudden, like yesterday, we were in the stroller, and then all of a sudden we're, having this event has happened and you're not here anymore. Just that total dropout. My TFMR moms, very frequently, they do not know that they are going to be postpartum. They do not know their milk is going to come in. They do not know any of these things. They just know that they have to schedule a horrific surgery.
Right.
And it is shocking for them to go through the physical aftermath of this, and they were never told.
Right.
So as medical professionals, we can do a much better job of educating our patients. And patient education is like such a super important thing, right? Like, it's a really important thing. So, so we can do a really good job of talking about the really uncomfortable things.
Right.
And we can do it in a caring and compassionate way that allows for everyone to hear. I feel that it's very important for the partners to hear. And for the purposes of this interview, I am talking about heterosexual couples. I can talk about same-sex couples. I can talk about, and I'm happy to do that in another podcast. But for today, we're going to talk about men and women. So starting there, and just starting with, your grief is valid and the trauma that you have gone through is real. And then second, the people around you, educating them, that's a big thing too. And having just a space for grandparents that have lost a baby that they were looking forward to seeing too. And then the resources. Okay. This is really difficult, but there are more of us. There are definitely more of us. So one of the things that I'm really excited to see happen, which has been a really good offshoot of social media, so much of social media is difficult, but this is a really good thing, is that there are more resources out there. So there are practitioners like me who are out there, and we are helping people through this incredibly painful thing. You can find practitioners on social media. There are groups like Return to Zero that specialize in pregnancy and infant loss, and they have a directory of practitioners around the country who are trained and focused on pregnancy and infant loss. It's evolving and ongoing though, and we are trying to get more people out there. Also, finding a practitioner, one thing that I always say to the bereaved is, what is it that you would like? Because so often they're told all this information. I mean, I remember I was told so much information. I was like, I don't know what to do. And they're told so much information. And I like to say, well, what is it that you would like in a practitioner?
Right.
For me, I'll be honest, it was actually really important that my practitioner be a lost parent. I'll be honest about that.
Right.
If you have a therapist who's great and they may not be a lost parent, but they're really great in understanding, stick with them. That's really great. But know what's important to you.
Yeah. And in terms too, I'm thinking of saying what you want and what you need. I'm thinking on like the friend and family level. I almost like taking it back to that casserole. Like we were joking about this casserole, but I do want to clarify it, when you even say to someone who's had loss, what do you need from a therapy standpoint? I totally get that. But to show up as a friend or a family member and say, what can I do for you? Or what do you need? That can be very overwhelming. So on the opposite end, I did want to ask you a little bit more about that for people listening. Maybe they feel good about helping their friend or family find a therapist or do some research for them. What are those other small things that they can do? Like we talked about casseroles and flowers, but like, let's actually be serious about it. We want people to just drop stuff off, right? Like it's a burden when somebody asks you what you need, right? It's like almost putting it back on you again.
Yep.
I guess if you want to tell a little bit more, like how does that make somebody feel?
Yeah. That burden can be intense. Before we hit record, you told a lovely story, if I can bring it up, about the letters.
Yeah, when people knew that I was doing this podcast, I was, people who haven't necessarily maybe experienced loss the way I have or others have, their big thing was like, I want to be able to help friends and family, and I don't know how. And so like, how do you know if it's okay to show up that day, or is it okay to drop the dinner off? You just don't know, right? And somebody said to me, how do you know? How do you know if it's like a good day to do it? And I'm like, you actually don't. I asked my mom this once. I was like, Mom, what do you want people to say to you? Like, how do you determine like what feels good, right? Because I watched growing up, someone might say to my mom something lovely about how we lost my sister, and they might make a very nice comment or an apology, or I'm so sorry for your loss. And for whatever reason that day, my mom would really be moved by it. And I would watch her be like, thank you. Like another day though, somebody might say the same thing to her. And I would watch my mom as a child, just like how her response like could be like, fuck off, basically. Like you just don't know. She's like, it just depends on her mood. But I do vividly remember really like, it's hard for me to ask my mom these questions. But I do it because I want to know how I can continue to better help other people, especially now that I'm a mom and I have my own kids. Like the empathy and the understanding that I have of my mom now is like, wow. I still will never know her pain, but now that I'm a mom, like I can maybe even imagine a little bit of it. But I do remember pushing her for some of these questions and answers because I'm curious and I want to do better all the time. And she told me that there was somebody after my sister died that wrote her letters every day. And a lot of people wrote her letters, actually. This happened in the 90s, like before we really didn't have cell phones and AOL was just coming about. So like people wrote her letters. And she said that she loved getting letters because if it was a good day, she could choose to open them and read them. Maybe she opened more than one at a time and would read these letters. But if it was a bad day, she didn't have to open it. She didn't have to look at it. She could tuck them away. And I don't want this stupid letter. Like she could put it away, right? But she had full control over receiving them, looking at them, putting them away or not, and didn't have to tell someone who sends a letter, like you don't know if they got it or not, right? Like it's not like an email that you can see was open or a text that you can see was read. It's there. It's there for whatever day she wants it to be there. And also, you don't have to reply. My mom said it was so liberating and like relieving because she could read the letter and she doesn't have to do anything about it. She doesn't owe the person a reply.
Yeah.
So I love that. And I think that it can be translated to moms today that like, know that if you send a text message or an email, that you don't need a reply, and you're not
That's right.
going to get one, but the
That's right.
person still can have it for when they want to read it. So I love this concept of the letter.
Yeah, I love that. And that's what I tell friends and family, which is remember this is not about you. And we're entering into a whole other brain space. We're entering into a whole other, experience. And just putting something out there. I love that about the letters because it is a tangible thing that allows the bereaved to know that someone is thinking about them and they don't have to do anything about it.
Right.
And also for us, friends and family, on the outside, it allows us to do something, provide, and also it's not about you. It's not about making you feel better. The truth is that life has tragic, uncomfortable things that happen alongside beautiful, wonderful, joyous things. And so I always say it is not about you. You may say the wrong thing. Remember to say I'm sorry. Remember to say, wait, I'm just here for you. And and kind of, provide because it's not about you. It's not about you making the situation better because you're not going to make the situation better. The situation, the circumstance, the loss is going to evolve. And that's another thing that I tell bereaved parents, which is I may talk to people when it happens, the demise might happen right then, or I might talk to people where the demise happened 30 years ago.
Right.
And one thing that I always say is that this evolves. And this baby, this beautiful baby, is still a part of your family story. This beautiful baby is still a member of your family. This is an evolution of your family, and that's okay. Having the wonderful parts of your pregnancy, the wonderful parts of the time you got to be with them, when they were alive, if it was a SIDS demise, you can still have those beautiful memories along with the tragedy.
Right. Right. I think too, in the act of wanting to make the space better and wanting to make someone feel better, you're taking that away from them a little bit too.
That's right.
I
That's
don't
right.
want, when I think of back to my mom, like she doesn't want anyone to make her feel better. She wants people to realize that she will never feel better. She will never feel better. Right. And there's this element too, we talked at the beginning about living with joy and grief. Like I'm one,
Mhm.
my sister and I, we now have a brother. Like my mom lives with joy and grief. I live with joy and grief after losing my friend. I take care of her son. And so like I think it can feel confusing as a human that you can have these like really drastic layers of emotions of like joy and grief. But when I think about grief, again, like of people trying to make us or anyone feel better, or even thinking that grief ever goes away, it doesn't. You can have both emotions and grief doesn't go away. And it's like I always tell people it's like a space. Like the
Yeah.
space around me, the grief is still here, and the space goes kind of like this. It's in and it's out. So some days it's further away from me and I
Mhm.
feel okay. And some days I feel like it's suffocating me, but it doesn't, this bubble doesn't go away. The space
Yeah.
might get bigger, but it
Yeah.
doesn't actually ever leave you.
I love that visual, and it ebbs and flows. And you said something really true, which is the bereaved. Some days we might be like, "Thank you so much for your words of kindness," and then other days we may be like, "Fuck this," like because we're
Yeah.
just so full of rage.
Rage.
Because we say grief, but grief is actually like this umbrella of like all these myriad of feelings, and then we might feel guilty about the myriad of feelings that we have. So grief and guilt like hang out together all the time.
Mhm.
And one thing that I say is that it's not that grief is bad, but we want to come to a place where our grief is informative and helps us grow. Because grief can be very shrinking. But if we allow it to be, grief can actually be a very informative growth place. For me, it changed the trajectory of how I think, how I practice, how I reach out to people, how I, handle my dogs, how I am with my kids, how I am with my husband, and of course that's a whole other issue too, right? Which is, what does a pregnancy and infant loss do to a relationship? But that's a podcast in of itself.
Podcast for that one.
But it really is something that can help you inform and grow. The thing is that it is a wild ride where there are some days where there may be all of these different feelings that you have all kinds of opinions about. And then there's another day where you might be, oh, I'm okay. I'm okay today. And I think that the goal is not to like make everyone okay and realize, this is, I'm all fully healed. The goal is, how do you live with your grief, that grief bubble, which as we go through life only gets added to, and, my own therapist once said, the secret to life is loss. And, okay. But there is kind of some truth to that, which is, how do we handle the loss in our lives? And loss can be a very big topic. It can be the loss of a job. It can be the loss of a pet. It can be the loss of a child. It can be the loss of our parents. All of these things are things that do happen.
Right. Oh, I almost feel like that's like a beautiful way to sort of wrap up a really sad topic, just thinking about grief in that context. And it's just,
there is something that I want to add, because it is a very sad topic.
It's a very sad topic, and I'm thinking of anybody listening to this who's had a miscarriage or had to terminate a pregnancy, or who's lost a baby or a child or a friend like we both have. It's just, my heart breaks for everybody, like a little bit right now as we talk about this, because I know you're out there, and I know I know the struggle and the grief and the agony and the joy seeping in. The emotions are just like really pulling in and out in that bubble that you're in.
Right.
So we see you.
We do. And I also want to know that there is care and compassion, and care and compassionate care for parents who have lost a baby, who have lost an infant, who have lost a pregnancy, no matter what your circumstances are. And also context is really important, and because these things don't happen in a vacuum. What is the larger picture? And everyone has their larger picture. I don't ever say everything is going to be okay again. And I don't ever say that, because the worst has happened.
It's never going to be okay. It's not okay.
Right. It's never going to be
okay.
What I do say, and I say this from a heartfelt personal place as well as a professional place, is you will feel joy again. It will be different. And one of the beautiful things about grief, and I did say, yes, one of the beautiful things about grief is that grief can help you incorporate a bigger sense of joy, so that you have a deeper understanding of the beautiful, wonderful things in your life.
Wow. That's very well said. Wow. Thank you for that.
Thank you so much for having me on.
Now that's the beautiful ending, Juliet. That's really well said. That's going to stick with me. I love that. Well, thank you so much for your time. I want everyone listening to know that obviously you are a wonderful resource, and I'll be sure to link your contact and your website. And we'll also put in the show notes just a more national link for you to search someone in your community if you are someone who has experienced pregnancy or infant loss and are looking for grief counseling. Because as Juliet said, while we can do better, there are people out there, and so just got to find everyone the right people that they need. So just thank you so much, Juliet, for being here, and thank you for those who are listening. I know that this probably wasn't the easiest one to listen to, but I appreciate you being brave and being here and doing hard things and listening to hopefully find a little bit of joy for yourself, or know one thing that you can do for someone that's experienced loss that can be comforting to them. So thank you for that.
Thank you. Thank you so much.
Thank you.